Bismillah ar-Rahman ar-Rahim. Today we are going to talk about multiple myeloma. And as we're going to talk about multiple myeloma, as its name implies, it is multiple. So we are going to find it in different sites. So what is multiple myeloma? Multiple myeloma simply it is malignant neoplasm of the plasma cells. So we will see a bad proliferation of the plasma cell. What is plasma cell in the first place? Plasma cells are the cells which are responsible for the secretion of antibodies or the immunoglobulins. This is the normal function of plasma cell. So it is the most common primary tumor arising from the bone marrow of the adults. So we'll see in the adult population. So when we talk about multiple myeloma, how we are going to diagnose it? Simply we are going to diagnose it first of all based on the lab diagnosis. So what we are going to see through our lab result, we are going to see there will be an increased serum protein with normal albumin level. This is the first thing we are going to see in patients with multiple myeloma. Also we are going to see that we'll have something called M-spike. What is M-spike? It is paraproteinemia, another name for it. What is it actually? It is, we will see that there is increased level of the light chain of the immunoglobulin. As we know from immunology, in the formation of the antibodies, we will have two heavy chains, which is right here, and two light chains, which is right here. So in spike, we'll see that we'll have an increased level of the light chain alone, maybe, or it could be the antibody as a whole. But mostly we are going to see the light chain of the immunoglobulin in the serum. So the most common type of the M spike, we'll see IgG, which occurs for 60%, and then comes in the second place IgA, which counts for 20%. Another lab result, we have something called Bence-Jones protein. And what is it? It is just like M-spike. So we are going to find light chains of the IgGs or the antibodies, but this time in urine. This is the difference. So if we see crystals of IgGs or antibodies in the urine, we call it Bence-Jones protein, another indicator of multiple myeloma. After that, we are going to see that there is an increased serum calcium or hypocalcemia, and we are going to know why is that in just a moment. In the blood film, usually we see there is normal or reduced count for red blood cells and platelets, with an important formation of something called Rouleaux formation. What is it? Rouleaux formation we can see right here in the picture. This is Rouleaux formation. This is Rouleaux formation. We see that red blood cells stick to each other. And why is that? Simply because we have an increased production of antibodies. So the antibodies will bind to the RBCs and they will make them sticky. So they will stick to each other and they will form something called Rouleaux formation. So in the clinical picture, we here talking about the presentation, the sign and symptoms of the disease. So usually the patient will come and complain of bone pain, especially the lower back of the spine. So he will suffer from backache, especially the lower segments of the spine, and also he will complain of anemia and recurrent infection. And why is that? Simply because we have infiltration of the plasma cell in the bone marrow. So this infiltration of the plasma cell will occupy more space in the bone marrow, and this will leave a smaller space for the normal cell to form. So it will result in thrombocytopenia and anemia, or also leukopenia, which explains why we have recurrent infections and anemia. And also we will see that the patient will suffer from multiple fractures. So he will suffer from especially the radius. And finally we'll see that we'll have renal failure, in which we will have decreased GFR. And why that? Because of the deposition of the M protein, as we talked before, in the nephron or the kidney cells. So we will say that we'll have bone pain and we have hypercalcemia. Why is that? We know that in the bone marrow we have a cell type called osteoclast. An osteoclast, it is type of the cells which are responsible for the regulation of the calcium in the bone marrow, and it regulates the calcium in the bone marrow by degrading the bone marrow tissue. So because we have an increased amount of antibodies, we will have an increased interleukins secreted from these cells, or the antibodies, or the plasma cells. These interleukins will increase the activity of the osteoclast, and the osteoclast, as it increases its activity, it is going to degrade more of the bone marrow, and this will result in multiple fracture, as we said, and bone pain, and the hypercalcemia in the blood. Finally, when we talk about the treatment of this disease, there is no significant treatment until now for this disease. So this disease prescribed as a poor prognosis disease with a median survival of less than 5 years. And also what we are going to do is only what we can give treatment for the symptoms such as anemia and bone pain by giving analgesic drugs. So we are going normally to give palliative care for patients with multiple myeloma. And that's all what we have about multiple myeloma. Thank you.